Good morning. Good morning, everybody. I think we are kicking off and starting our first Hot Issues in Health webinar for 2025. I suspect folks are logging in, getting themselves comfortable, maybe grabbing something to drink. So we will start in maybe just about 15, 20 seconds. Thanks for joining us this morning. Welcome. If you are logging in, it is great to have you with us this morning. It looks like it is just 8. We have so much to talk about. So I do want to get us started, kick us off. Welcome, as I mentioned, to the Colorado Health Institute's first Hot Issues in Health webinar of the year of 2025. My name is Sarah Schmidt. I am the president and CEO of the Colorado Health Institute, and I am really grateful to our panelists who have joined us today and to all of you who are making some time for this important conversation. Just a little bit of housekeeping. We are recording this webinar, so just wanted to let everybody know that we are recording. We are also going to be holding some time at the end of our conversation for questions. So please use the chat or the question and answer function to drop your questions in there. And just to warm everybody up and make sure that folks know where to find that chat, maybe drop into the chat if you are a coffee or a tea or some other kind of a morning beverage drinker. I'm just sort of curious Karam, what's yours?
These days it's more coffee.
Right.
Yeah. But I go between both. I go coffee, like a black tea mid-afternoon, and then an herbal tea.
That's solid.
Yeah.
That's a solid beverage program.
Oh, yeah.
Nice.
I know you're a coffee person.
I'm a coffee person. Looks like we are getting lots of chats, 2 cups of coffee, espresso, coffee gallons, good stuff. Well, great. Hopefully you are all also seeing the chat and can share with one another how we get ourselves through these cold mornings and how we will fuel ourselves as we get through the year, because there's a lot. It is just 3 weeks in, and it already feels very full for 2025. Many of you joined us at our in-person or virtual Hot Issues in Health conference in December, where we did talk about some federal and state issues that we anticipated on the horizon for this year. And we said that we were going to continue that conversation with all of you as the year unfolded. And here we are doing that. So we're excited to have our wonderful and insightful and expert panelists with us to help us understand and have some conversation around how the year might unfold. I'm also very pleased to be joined by my colleague, Karam Ahmad, who is going to help moderate our conversation today. I'm going to turn the floor to Karam.
Thanks, Sarah, and good morning, everyone. And thanks to everyone that's joining us this morning. For those of you that don't know me, I'm CHI's Managing Director of Partnerships and Development, Cara Bradbury. I've been at CHI it'll be 8 years in May, and it's an honor to serve in this role. It's a really fun job, so I'm super excited. In this role, I'm really focusing on building and strengthening partnerships across Colorado, across the region, and really thinking about how we foster collaborations that really support CHI's mission and drive the meaningful impact for the communities that we serve. Our mission at CHI is to strengthen communities and systems with trusted analysis and collaborative solutions to improve health. As a public health institute, CHI provides resources to make those systems more effective and equitable. We ask critical questions, we make sense of complex issues, and we support others to reach actionable solutions. And really today, our panelists are going to help us do all of these things as we explore the opportunities and really the challenges in store for the health sector this next year and how we as a community can make positive change in the year ahead. So today we're joined by some really great panelists, and each are playing a critical role in influencing and advancing health in unique ways across Colorado. Each of them are doing that in a very specific position in their own sort of form of influence. So whether that's through direct policy making in the legislature, as with our state representative, Kyle Brown, who's actually the chair of the House Health and Human Services Committee. Congrats, Kyle. Or through philanthropic funding that can advance health equity by providing resources and momentum behind specific issues and initiatives, as demonstrated by our guest and friend, Karen McNeil-Miller, the president and CEO of the Colorado Health Foundation. And then they can also advance at the local level through the direct impact of public health workers and the collective influence of their agencies, as is with our final guest, Cara Bradbury, the executive director of CALFO, also known as the Colorado Association of Public Health Officials. So each panelist has a very different sort of form of power and influence, and really in public health and policy and in across many dimensions, and all are going to be critical as we move into a new and challenging year. So thank you all for joining us this morning for this conversation. We're really excited.
All right, great. Thank you, Carm. So we are going to get into our conversation. Oh, wait. Oh, no. Yeah, we're ready. Sorry. Still getting ready. Just a brief overview for how our conversation is going to unfold today. We're going to do kind of a broad question for each of our panelists to respond to. Then we're going to pivot to ask for some opinions and response around federal issues. We'll talk about state issues. And then we have a couple of questions that are really based on our three panelists' unique perspectives that Karim just shared a little bit about. So panelists, please ask one another questions too. This is a conversation. And as I mentioned, please, if you are joining us today and you have questions, please do drop them in the chat or the Q&A function. And we're going to try to save some time to get to your questions. If we don't get to them, maybe we will certainly track on those and see if there's a way that we can respond offline after the webinar today. So with that, big picture question, I would like invite each of our panelists, starting with Karen, to start by sharing. Karen, what do you see as the major themes or challenges in the health and public health spaces where you expect to focus your efforts, the efforts of the Colorado Health Foundation in the coming year?
Thank you, and good morning, everyone, and thank you for inviting me to join this conversation. And I will say that to your chat question, I am decaf cappuccino or Diet Pepsi. Those are my morning drinks.
Excellent. I love the Diet Pepsi.
So what we will be focusing on, what we will continue to be focusing on at the Colorado Health Foundation won't change. The North Star stays the same, even though there may be some deepening of some work and maybe some additional work depending on the external environment. But certainly access to primary care and behavioral health services are still top of mind for the communities we are in service to, and those are communities who live with low income, who have traditionally been marginalized or have traditionally had little power or privilege. And so on the whole health, the whole person side, there's access to primary care and behavioral health, whether it's clinical or community supports. And then taking a broader view of health, the issue that's on everyone's mind is a health issue, and that's housing, both housing inventory and housing affordability, economic opportunity, so that families can make a wage that allows them to care for their families in the way they would like. And those are a couple of the main issues. I think we'll talk about some populations in particular as we go along in the conversation.
Thank you. Thanks, Karen. Now let's turn it over to Cara. Cara, maybe what's your beverage of choice? And then what are the issues and things?
Yeah, like Karen, I am actually also a decaf coffee drinker, which is we're a rare breed. And I always appreciate when I get a good decaf latte in my case. Yeah, so I'm going to speak specifically about public health officials' sort of top concerns right now. I think there are a lot of potential concerns on the horizon, but I'm going to highlight three that seem to be coming to the top for public health officials. One of the biggest concerns is around the potential impact of policies targeting minority populations. There's a lot of worry about how things like mass deportations or other similar actions could affect the overall health and well-being of entire communities. So to that end, local public health agencies are already sort of stepping up and working with schools, nonprofits, and other partners to plan sort of proactive and supportive measures in response to those potential actions. Another big issue is around immunizations. There's been a lot of talk lately about vaccines, and I think the concern is that some of that rhetoric could lead to more declines in immunization rates that would really put years of progress in preventing certain diseases at risk. And then the last is about funding. There is really uncertainty around potential federal cuts that could be a huge challenge. Some of these cuts could impact critical public health programs, and we need to be ready to adapt and figure out how to sustain essential services. And it also raises serious questions about how to stay prepared for future emergencies if they arise. I think that's those are the top ones for us.
Thanks, Cara. Great. Representative Brown, good morning.
Morning.
What do you like to drink in the morning? And tell us what's on your mind in terms of themes and challenges.
I like tea, or really hot chocolate, if I'm being honest with you, because I'm apparently a 5-year-old stuck in a 42-year-old body. I think this year the main focus of the legislature is going to be on funding, and specifically on funding for our safety net programs and providers. We have a very large hole in our state budget for the coming year to the tune of about $750 million. And while we have money above the Tabor cap, as any policy person in Colorado knows, that's not money that we're allowed to spend. So the question is, how are we going to maintain access to Medicaid services? How are we going to stabilize the safety net going forward? Especially in the wake of the Medicaid unwind, we still have a lot of safety net providers who are seeing payer mixes that are unsustainable, payer mixes that look like what payer mixes looked like prior to the expansion of the ACA. So we need to continue to have those conversations about a sustainable source of funding and making sure that we don't get into this situation ever again. I will also say that I think that along those lines, we will be having conversations about value. There's constantly this balance in healthcare between access and costs and quality. And we are trying to, find better access, better quality at lower costs. And we have, so right now the legislature is planning, we're going to have discussions about mental health care standards. We're going to have discussions about the role of pharmacy benefit managers. We're going to have discussions about, the 340B program. And we're going to have discussions about, again, funding for the safety net that's long-term and sustainable. So those will be the main themes that I think you'll see coming out of the legislature this year.
Thank you, Representative. Before I turn it to Cara, I just wanted to check in. Panelists, anything for one another before we move on?
So building off of the changes that you all are anticipating, we're of course only a few days into the Trump administration. And in addition to the many, I think over 200 executive orders, he and his appointees have already really made some clear statements in terms of policy direction. And that includes, of course, potentially steep cuts to social and health benefits. So my first question is for you, Karen. The Trump administration and its allies is targeting immigrant and trans populations, and Congress could actually pass a law to allow the administration to shut down some nonprofits it deems to support terrorism. What needs to be the philanthropic response to all of this?
Yes, well, I think there's a philanthropic response, and then there's also a potential governmental response, community response.
Right.
But you're right. It's been highly touted the kind of the attack on immigrant status, the revoking birthright citizenship, targeting and eliminating the nonprofit status of organizations that they may deem to be supporting terrorism, LGBTQ trans, as you say, particularly trans youth. The philanthropic response is at the ground level is supporting the organizations that are dealing day to day with these issues, who have community members as their clients, as their guests, as their patients. So trying to support those organizations. And then longer term and more 30,000 square feet, 30,000 feet rather than on the ground, there are going to be a lot of legal challenges to many. We believe there'll be legal challenges. And so a lot of the philanthropic response is going to be supporting legal defense funds for organizations to take these to their local court, to their district court, to their regional court, to their state Supreme Court. And so the philanthropic response is going to be supporting some of that, and certainly working with our advocacy partners to change policy, to address policy at the federal level, at the state level, at the local level. And so there's plenty of work to do. Cara mentioned a lot of another issue around immunization. We know that's going to be a focus. And then Representative Brown also mentioned the funding. What happens if communities that count on Medicare, Medicaid lose some of that funding? What happens to our safety net organizations? What happens to our hospitals like Denver Health that serve a huge population of the uninsured or less insured? And so the philanthropic response can't be to step in and supplant government funds. We're a rounding error on the state's budget. So philanthropy, I believe what we're going to want to do with the Colorado Health Foundation, and what I hope philanthropy is thinking about doing, is how can we be strategically opportunistic? Where are there places that we can and we are best suited to intervene, if not to support, but to give cover to offer help to offer additional resources to. And we'll talk about that, I think, later as we talk about the state level itself. But the philanthropic response has to be opportunistic in this environment and not lose sight of our North Star, the North Star that we're already all working towards in the equity arena.
Thank you, Karen. So thinking about being strategically opportunistic, thinking about the role, Kyle, about the state legislature against a very mercurial federal backdrop and uncertainty, what do legislators need to be effective?
Well, we could use a gigantic pot of money. That would be helpful.
Money helps.
I mean, the truth is, we need good information. We need to listen to that information, which is not something that we always do. But I would also say that, for us to be successful, we need to be thinking about and prioritizing the needs of our communities. And I think Karen and Cara have highlighted those. We're at a time when, folks at the highest levels in our federal government traffic in misinformation and disinformation about a variety of issues, whether it's, the role of immigrants in our society or the efficacy and safety of vaccines, any number of issues. We cannot let the kind of federal circus get in the way of us doing the good work for the people of Colorado. So we need to continue to do what we can at a local level to protect Coloradans. And that includes, passing additional protections to make sure that we have access to basic health care for every population, LGBTQ, folks who need reproductive care, or any number of other issues, mental health care. But we also need to make sure that we are, being realistic that there will be decisions that the federal government make that we are not able to protect Coloradans against. And we will do our best, but there will be ramifications if Trump decides, Trump and the Congress decide that they want to cut Medicaid funding dramatically, or if they want to, end the ACA. That went really well the first time, by the way. We're going to have to deal with those, and so there will be ways that we can soften the blow, but it would be difficult for us if Trump rolled in the army and starts deporting every person who's brown in Colorado.
Thank you, Kyle. So yeah, really a focus inwards on insulating and protecting. So Cara, we've heard a lot about RFK Jr. and HHS and other potential appointees whose positions on things like vaccines and raw milk are counter to public health priorities. How are your members in CalFO preparing to respond, and folks in the public health sphere preparing to respond?
Yeah, well, I think we have one key advantage, and that's that when done right, public health priorities are actually community priorities. The issues we focus on, whether they're longstanding things like vaccines or emerging, they really are rooted in a movement to protect and promote the health of the communities that we serve. So, at its core, public health is about working on behalf of the community. And if we lose sight of that, we start seeing, or if we start setting priorities in isolation, or imposing them on people, we kind of lose what makes public health truly effective, and that's amplifying community voices. So, staying connected to the communities that we serve is really how we're going to stay sort of relevant and trusted and impactful. I think personally that we also need to trust that when given the right information, people are capable of making good decisions. So, we do have an issue with misinformation out there. It's going to be a big challenge, but it's essential that we take people's concerns seriously, and we listen to them, and we engage in a real dialogue that makes them feel heard. So if someone has concerns about vaccines, we need to have that discussion, regardless of where those concerns actually came from. We also, I think, need to be clear and honest about the risks involved in different choices. So deciding not to vaccinate is really fundamentally a different choice than choosing to drink raw milk. And we must expect that people are going to make their own decisions, and hopefully do that on, clear, honest information that we can provide. So for me, I think these challenges are really a reminder for us to double down on what public health does best, and that's science-based education. So many public health leaders are already working hard to kind of strengthen their partnerships with trusted community voices, and equip those local leaders with the tools and the data that they need to address the concerns in the community in ways that resonate with those community members. Our messaging needs to be consistent and transparent. I know that trust in public health officials has taken a little bit of a hit. I guess I would argue that maybe politicians aren't doing a whole lot better. And the reality is that trust across the board has actually really been strained. And I certainly wish that we didn't have to revisit the why behind longstanding sort of proven public health measures like vaccines. But I do believe that the public deserves answers. And if people are asking why we strongly recommend vaccines while advising against drinking raw milk, then we owe them sort of clear and thoughtful explanations. So, we really can't expect trust without transparency and taking the time to explain the science. Even if it feels redundant or sort of obvious to public health people who maybe live and breathe some of that information, it's really how we start to rebuild trust. And I think these conversations are an opportunity for us to demonstrate that public health is about empowering informed choices, not just issuing directives to people.
Thank you, Cara. Yeah, and that that really resonates, that trust without transparency is not possible, and that harmony between the community, the public, and public health is going to be so key. Thank you.
Thank you. Okay, we could continue talking about state response to federal issues, but we do want to pivot and have a little bit of time to talk about what we're expecting at the state level. And certainly, Representative Brown, you talked a little bit about that already. We know the budget is top of mind for everyone, and Medicaid is a big line item in that budget. So we want to, perhaps we'll start with you, Representative Brown, if you'd be willing to share how the legislature is thinking about Medicaid right now. You shared a little bit already, and if there's more that you'd like to add, that'd be great. How do we balance access and cost and quality? Medicaid is so critical, not just to so many individuals within communities, but our providers, our long-term services and supports providers. It's a foundation of health. So would love your thoughts and feedback on how you're thinking about that and how your colleagues are thinking about that in the coming year.
Yeah, thanks so much. I think that, when it comes to Medicaid, I think there is a commitment by the majority, the vast majority of the legislature to try to preserve and protect the Medicaid program. In particular, I think there's a concern that we would use Medicaid and cutting provider rates or services for folks as a way of filling a hole. We may not have a choice, but I think there is a recognition that, gosh, Medicaid is usually about life and death for folks. And, of all of the things that we should be thinking about and should be on the chopping block, those issues that are literally life and death for people should probably be towards the bottom. Let's just put it that way. So I'm committed in my role to protect the Medicaid program and the funding that's associated with it. But it's a pretty large hole. I think we find ourselves in a place where Medicaid spending, Medicaid spending is higher than we expected it to be. And I don't think that's anybody's fault necessarily. I think that is a function of an aging population and actuarial science being, about as good as a buckshot, right? There's a wide confidence interval on some of those estimates. And sometimes they get it right and sometimes they get it wrong. And then we're faced in the future with how do we plug that hole? And I think that's what my colleagues in the Joint Budget Committee right now are facing. So, to be continued, to certainly, but protecting our most vulnerable is certainly my priority, and I know it's a priority of many in the legislature. Thank
you, Representative. Karen, you've already mentioned a little bit about philanthropic funding as rounding, especially at the federal level, but certainly as we're thinking about the state. How are you and your colleagues really thinking about the role of philanthropy, whether it be these changes within the safety net or these other programs? Every agency is looking at ways and places to cut, and we know that cuts across human services and public health and environment and Department of Local Affairs. So curious how are you feeling?
Well, we try not to be discouraged, and as I look at the participants, I just see friends and colleagues and folks leading organizations or in organizations that are at the ground level in community. And so I think it was Representative Brown that said, and Cara, that said we have to listen to community and really focus on what's the community issue, and not be as broad, but really be very specific. And that may be different per community or per region. And so we have to be mindful of that and really listen to the providers on the ground. Mm-hmm. We also have to try to support them in ways that may be capacity building for them. How do they prepare themselves to be as effective as they've been in the past, perhaps with less? How do we help shore up the leadership or give the leadership the training and development they may need or may desire to be able to navigate through these times? Certainly there's money we can provide. We would be focused in that, as I said, strategic about that, but particularly in the safety net, particularly with those communities that are going to have the hardest uphill battle, LGBTQ communities, immigrant communities, perhaps the disabled community. And so we've got to be focused. We've got to support our advocacy partners around the state. There's a group now that's has been very critical of the state's Medicaid unwind. The department the HICPUF would have a different view on that, but at the community level, there's discontent with how that happened. So we're trying to support the community and their desire to understand that. And then we've got to figure out, as a philanthropic community, again, what's the main thing? And keep the main thing. And support our public health workers, support the legislature and their efforts to move the needle on the populations that need it most, the populations that are most vulnerable, the populations who are historically been without power or privilege, and populations that live in communities that live with low income. That's our focus at the Colorado Health Foundation. We think that's the right focus, and we know those communities were hard hit, have been really hard hit since COVID. They were hard hit before COVID, worse hit during COVID, and now it looks like maybe there's going to be another tumble down, and we've got to help support and shore them up.
Thank you, Karen. And before I ask Cara a question, I'm just curious, Representative Brown, if you'd be willing to respond. Lots of bills come through with the gifts, grants, and donations attached to it as a funding mechanism. And I'm curious how that lands for you. And when you think about policymaking at the state level, knowing that there is a fiscal impact, but of course, this is the year that a fiscal note means it is not moving too far. How do you see that strategy, and how do you see that interplay between state level policymaking and then reliance on external resources for implementation?
Well, I think, as Karen mentioned, I don't think that's a sustainable way for us to fund core government functions. You know, core government functions need to be funded by government, in my opinion, because we expect things people expect things of government that the private sector or even philanthropy don't necessarily need to or should be accountable for, right? The government has kind of some of the highest levels of transparency, that is expectations of transparency. When I was first working in the Capitol, and there wasn't very much money, the gift, grants, and donations trick on bills was quite common. And then we've had a number of good budget years and over the last several years. And so I haven't seen that in a while. And now it's coming back, right? Everything old is new again. Maybe it's because it's like flare jeans or, whatever else. But for me, I appreciate that we need to continue to move forward. And I think it can be effective temporarily, assuming that there is buy-in from the philanthropic community to provide some startup funding. But ultimately, we as a state need to realize that we're going to have to put dollars behind things if we want them to sustain. And that is a hard conversation, because then we get into conversations about the sustainability of our budget given Tabor and its limitations, and what does Tabor do to keep us from being the best version of ourselves.
Thank you. Thanks. Cara, just want to give you an opportunity to weigh in here. You certainly are representing our local public health officials and that are part of local government. And we know that there's that interplay between what happens at the Capitol and the state level, and then what is required of our local partners. Sometimes there are mandates or bills that come down that don't have that funding attached, and it's quite possible that we could see more of that based on the conversations that we've had already this morning. So please weigh in a little bit. How are your partners at the local level feeling about that? And where are some avenues where you think there could be stronger partnership and collaboration between that state and local level?
Yeah. So if I can, I would love to make a couple of comments about some of the things that Rep. Brown raised around kind of the Medicaid situation right now. I mean, I think the tight state budget really pushes us to prioritize, and obviously Medicaid is a huge chunk of the budget. And I think there were some comments about, those costs are going up. Maybe that's around an aging population. There are some other drivers. I think I would be sort of remiss to not point out that some of those drivers could be a lack of investment in upstream public health programming that sort of can kind of keep those downstream costs lower. And we're in a real challenging situation when Medicaid's costs sort of keep expanding and we have no extra dollars to be strategic in how we can invest upstream to kind of try and get those costs in control. So there's a lot of evidence out there that demonstrates that investing, even modest investments in public health, help to lower those costs overall. And I think we really do need to figure out how we can find pockets of funding. It's to the point that was made, it's really challenging when it's a life or death sort of expense over here that has to be met. But we can't get ourselves out of this cycle. So that's a real challenge, I think, with the budget right now. When it comes to sort of unfunded mandates specifically, so these are always kind of a challenge for public health and local governments. I think one silver lining from my perspective is that it demonstrates that there's a recognition of the importance of public health. So we can kind of look at it as, okay, well, at least we agree that this is important and should be getting done. But when there are mandates, what it does ultimately do, if they're unfunded, is sort of reduce the flexibility and the resources that local agencies have to respond to sort of the unique needs of their community, because now their budgets are being stipulated in a way that kind of reduces how much kind of flexible funding they have. And it kind of hampers that whole process of really engaging with the community, doing community health assessments, and getting their buy-in, and then having the resources to kind of have that partnership going forward. So that is why I think it's really important that local voices are part of the conversation when state policies are being developed. So, at the very outset, if we're considering mandates, let's get that local voice involved and make sure there's alignment there. There are some advantages to certain mandates that can look like consistency. I mean, the other concern that we often have is equity, right? We want everybody, wherever they live in the state of Colorado, to have access to the same type of resources. And so there's these trade-offs between being responsive to unique community needs and ensuring that some communities aren't getting, different services and better services potentially. So we have to be thinking about all of those things. I think when mandates are in place and they're kind of active, then local public health agencies and local governments sort of have to look at strategies to try and fill those unfunded mandates. And that can be through things like regional resource sharing. Unfortunately, I think, post-pandemic, we actually saw a number of the public health districts in the state break apart because of differences in those communities about how they wanted what they wanted their public health services to look like. But I think there are potentially other opportunities for agencies to align themselves with more like communities and kind of, try and reduce the overall cost by more partnership in regional ways. And then really just having continued conversation around co-investment, co-investment from the state and from the local level, other partners, maybe philanthropic partners, but really trying to make sure that we're kind of sharing the burden of what those mandates are and where they're coming from. So yeah, I think just making sure that there's strong communication and that local voice is being heard are going to be kind of key components of dealing with mandates.
Thank you, Cara, and all three of you.
Talking
about the state budget. Oh, Karen, yeah, did you want to respond?
If I could go back to something that both Cara and Representative Brown have mentioned, that is should be part of the philanthropic response, and that's combating disinformation, the rampant disinformation, and not just combating it, but replacing those harmful and inaccurate narratives with new narratives, with what's the narrative change that we need to have in communities? What's the narrative change we need to have amongst our legislators? What's the narrative change for the general public? And so there's philanthropic organizations, including us, are investing in media that are committed to that narrative change and combating disinformation. And that's a real issue. It sounds benign, but it's actually quite toxic, and is underneath a lot of the things that we see that we've been talking about this whole time, and a lot of the populations, immigrants, LGBTQ, the unhoused. There's just a lot of misinformation and negative, toxic narrative. And there are philanthropic organizations that are really tackling those with our nonprofits and with community.
Thank you, Karen. I appreciate you adding that into the conversation. I feel like, certainly we at CHI, we in our focus and commitment to data and evidence-based, wade into that space quite a bit and have some of our own concerns. I also appreciate all three of you talked about the importance of really listening to community and how do we find that narrative there? How do we listen when we're hearing perhaps something, misinformation, combating that, finding the new ways to engage others to be reaching a different way forward when that toxicity is so present. So I appreciate you naming that. Thank you.
So I know we've got one audience question, and I know they've had their hand up for a bit. So I'd like to see if they are available. Dolores, could we get you off mute and field that question? Go ahead.
Hi, I am so sorry. I was actually on my phone and it was a mistake. I raised my hand. I don't have a question at the moment.
We got to come up with a good one now.
Pressure's on.
Now that I'm on the spot. No, I'm just listening to such a great conversation. Thank you.
Okay, no worries. Well, Karen, I've got a question for you. As a funder, the Colorado Health Foundation really has an intentional focus on health equity, on diversity, supporting diverse and underserved communities. Given this recent political and corporate backlash around DEI initiatives, how are you thinking about ensuring that you can continue to advance this work with sort of this in this environment?
We and our grantee partners are not backing off. This isn't the time to back off or retreat. It's the time to lean in and march even harder. So we certainly remain committed to health equity through racial justice. And I also have to add to that, while we are race explicit, we are not race exclusive. And because what happens when I say health equity through racial justice is someone says, well, what about the poor white folks in the state? Don't worry. We are still concerned about all folks who are live with low income. And, when you look at those who are most affected, where the equity and the gap are the largest, those in almost every case are people of color. So we do prioritize people of color, but we in no way, shape, or form are neglecting or ignoring the majority, a lot of folks in this state who are white and live with low income. But we're not backing down from DEI, from equity, from trying to help communities get a sense of belonging. Our grantee partners are counting on that. We're counting on them. I actually think we hear the media again in disinformation. The media tells us that there's this big retreat. I think and I hear that there are many organizations who have made that commitment to DEI and equity who are still going to do that work. They may have to rename a department. They may have to talk about it in different ways, but they're going to still continue to work. We're not changing how we talk about it. We're very committed to not try to make it sound anything other than what it is. And so our commitment, as well as our grantees, it's still as strong as ever.
Thank you, Karen. So we've got a couple of questions in the Q&A. We've also got it's not a question, but want to comment and say thank you to our amazing Colorado leaders. I'm proud to be in Colorado and hope we can all remain vigilant in our finding practical ways to counter sort of what's going on currently. So there are two questions. One of them is from Colleen Lampron, and it's for Cara and maybe Representative Brown. She said, yesterday I read an analysis of the federal executive order that cuts the federal workforce. How many people are impacted by this in Colorado, and how does that impact our tax base?
This is a question for me, and it's about cutting the federal workforce.
Either you or Representative Brown can chime in.
Boy,
Go ahead.
Go ahead, Cara, if you want to take that one.
I've been digesting as much news as I feel like I can possibly digest this week, and I will say I have not come across the cuts to the federal workforce. I've heard about telehealth working and freezes to communications, but that one I can't comment on.
Yeah, I'm not sure what the size of the federal workforce is in Colorado. I'm sure it is probably tens of thousands of people. I'm sure that if there are cuts to the federal workforce, it will have an impact on our economy. It will have an impact on our tax base. It will, and most importantly, it will have an impact on families who rely upon these jobs to put food on the table. I'm very concerned, just at a visceral level about the kind of brain drain, for lack of better words, or just a hollowing out of our federal agencies. It seems to me that many of the appointees at the federal level are designed not to support the agency or move it forward, but perhaps to undermine its very mission. That is very troubling to me as a lifelong public servant who believes in the mission of these agencies. So I'm hopeful that we won't get to that point, but there clearly that is the federal administration has a different view of federal service and our core civil servants who do the sort of unsexy work of the federal government sometimes.
Thank you both. We have another question that is centered on health and food security. So any discussion at the state level around the intersection between health and food security, there's concerns around food access and nutrition being an afterthought at this time. And that question is for anyone.
I don't know about at the state level, but I can say the philanthropic response state in this state is we absolutely know the connection between health and food access and food and involved in food justice work. We had a 5-year commitment to working in food access, and that 5 years is coming to an end. Yet at the same time, the Colorado Trust issued their new strategic plan and one of their 3 priorities is food access and food justice. So we know that connection. We know that connection to physical health. We know that connection to behavioral health. We know that connection to a sense of being able to be a contributor in school, to be able to be a contributor at your work. And so it is in many philanthropic spaces across the country and in Colorado, food access and security is a big topic and absolutely a direct connection to overall individual, family, and community health.
Thank you, Karen. Cara, Representative Brown, anything you'd like to add?
I will just say that we talked, it's just been a long-standing theme in Colorado that we have a number of people who are eligible for food programs that are designed to address food insecurity, but they are not enrolled. For whatever reason, Colorado has a history of larger than we should percentages of people that are eligible but not enrolled for those programs. So that came up in the SMART Act hearings again yesterday, and I would love to continue to work on that and make sure that we are maximizing those programs and those federal dollars.
Thank you, Kyle. So we got a question from Catherine Mulrady, also just a thank you. I'm wondering if we could get Catherine to unmute if she is available. Otherwise, I can read the question. But this is a good one.
This might be our last.
Yeah. Good morning, everyone. Thanks for taking the question. So Karen, I heard you say, let's keep the main thing, which I really couldn't agree more with that sentiment. And I think in health and healthcare, we're challenged by always kind of facing competing priorities, and we are facing threats from multiple sides, as you've all articulated very well today. I wanted to thank Representative Brown for his comment about leaning into value and not just focusing on kind of one leg of the 3-legged stool, and thank Cara for your comments around the need to focus on prevention and moving some of our resources upstream. But I'm struggling with finding the main thing in all of the conversation. And so my question for you 3 today is kind of maybe over the horizon of the next 6 months, as you're looking out at all of the things ahead of us, what should the kind of top 1 priority thing be that could be a unifying force for the health and healthcare communities in Colorado for us to lean into? It's an easy one, I know, don't worry.
Yeah, thanks for giving us the easy questions.
I think, it's a really challenging question because I understand the desire to want to kind of rally the troops and have that alignment. And I will say from my vantage point, it's a challenging question because we spend so much time in local public health in particular, trying to elevate the voices of community and really sort of having that space to say, we want to hear from you, and it may look a little bit different. The impact on your community may look a little bit different. And so that's a real tension from my vantage point, representing local public health officials. That's not to say that there can't be some real strategy happening to sort of, align the grass tops with the grassroots and sort of say we have to do some priority setting. The reality is in a, resource scarce environment, we can't just be all over the place. We have to have some alignment. And so I think for me in the next 6 months, what I'm hearing from local public health directors is like this furious effort to touch base with all their community partners, making sure all of those relationships are, fresh and kind of up to date, and hearing from folks, and then seeing kind of what percolates up. And so it's going to be kind of a bi-directional communication. And I think we're just going to have to be flexible and nimble, because we can, plan for something and then have something else pop up. So those are the thoughts. I'm not sure if that's a concise answer, but that's just what kind of comes into my mind as you pose that question.
Catherine, it is a challenging question, because I don't think the main thing is one thing. Communities are layered, communities are nuanced. And so I think the main thing is, this is like like peace officers are there to serve and protect. I think that's what the main thing we have to focus on. Who is it that we need to serve, and who is it that we need to protect in our communities? And if we could all focus on that, that may be a different response, but there's probably going to be, once we listen to the communities, there's going to be probably one or two central themes. But if we could all commit to serving our communities and protecting our communities.
I would echo that. I think there's a lot of ways that we're going to need to protect our communities. Affordability, I think, in all spheres, especially in healthcare, will continue to be a theme. It's hard for folks to put food on the table if their premiums or their healthcare costs are going up. But they also want to make sure that they're getting what they're paying for. So we're going to have to continue to focus on that. That's why I think I use value, is because it is not just paying more money. It is not just cutting costs, but it's making sure that we are cutting costs in the right way and increasing quality at the same time, and access. So those will have to continue to be focuses, I think. But yeah, it isn't one thing. And I think when you see the legislation that my caucus and even me as an individual legislator are working on, it isn't meant to vilify one particular part of the healthcare industry, or say that like necessarily the insurance companies are the problem, or the pharmaceutical companies are the problem, or the hospitals are the problem, or the doctors are the problem, or whatever. There's no one. Everybody has their opportunities, and we can make the system better for everybody by focusing on what we need to do in any given area. So.
Thank you, Representative Brown and Catherine, for the question, and for our panelists. I'm not going to summarize. You all did shared some really powerful things with all of us today. And this is a conversation that I'm grateful that we had this morning, and that I know we will all continue to have with one another, with our partners, with our neighbors, and look forward to having those discussions with all of you. So thank you very much to Karen, to Cara, and to Representative Brown for joining us this morning, and to all of you very active questions and chat, people giving and sharing information in the chat. I want to flag that we will be posting the video of this webinar online later this afternoon. So if you want to re-listen, or if you had to, for whatever reason, it's going to be available online. So please know it's there as a resource for you. So before we wrap up, I just wanted to flag our next webinar. Mark your calendars. Please join us on February 20th. So that's about a month or so. We'll be turning our attention to a different issue, school-based health and our young people in schools. We will be sharing findings from our newest needs assessment on school-based health centers. We have a couple other partners joining us from, I believe, from advocacy community, state agencies, and communities. So please mark your calendar and get your hot chocolate ready. So we are ready for our 8 a.m. webinar on February 20th. Look forward to spending that time with you all. Thank you, everybody. Appreciate all of you, and I'm grateful for your partnership and the work that you all do on behalf of Colorado. Thank you.
Thank you, CHI.